Hello, I'm Lou Kaplan, the SCCM President. Today, I'd like to share with you what SCCM has accomplished and what we continue to pursue during the COVID-19 pandemic. But first, allow me to thank each of you for your dedication, passion, and commitment to excellence in critical care. The volume of patients you've managed has been extraordinary and at times overwhelming. Patient acuity has been high, and unlike your usual daily set of concerns, you've been faced with tangible ones about your safety as well as those of your loved ones. All of this has happened while you are wrapped in PPE with your facial cues hidden behind masks. Social distancing has separated us from one another and limited our very human touch. These are indeed trying times. However, you, not PPE, ventilators, nor therapeutic agents, are our most precious resource. We recognize the vast stress under which you've been operating and the increased risk of burnout syndrome that you face. SCCM is committed to being your partner to help you emerge from the pandemic mentally strong and still passionate about critical care, as we have been with you every step of the way thus far. Those steps began with information. As SARS-CoV-2 came to the U.S. shores, we sent you ICU preparedness materials, quickly followed by our analysis of U.S. ICU resource availability. This document alone has been accessed more than 130,000 times and has spread widely through the media. That was just the beginning. SCCM is globally well regarded for its multi-professional education at Congress, online and through in-person courses. Fundamentals of Critical Care Support and Fundamental Disaster Management contained vital information that you could use to train non-ICU clinicians to help care for the critically ill during the crisis. We made those resources freely accessible at covid19.sccm.org. I'm proud to say that nearly 500,000 clinicians learned critical evaluation and management skills from the resources that many of you helped craft. Well done. This speaks to the great value of SCCM's educational programs. Complementing those offerings is a wide array of virtual interactive sessions that address COVID-19 topics, as well as on-demand recordings, manuscripts, checklists, micro-learning segments, and other educational resources. Topics cover all things COVID-19, like the ethics of triage and resource allocation, labor pool deployment, nutrition support, anticoagulation, communication, managing uncertainty, team dynamics, and much more. It is literally filled with hundreds of educational items, all centrally housed in SCCM's COVID-19 Rapid Resource Center on our website at sccm.org/disaster. There, it is easy to find just what you and your team needs at a moment's notice. And you can submit resources you've developed and want to share with your colleagues on that site as well. We've hosted free webinars with many organizations, such as the American College of Emergency Physicians, and discussed topics on which we have less information than we want, as well as unanticipated consequences of pandemic care. The patients for whom you have cared present vital information that can help us learn how to better manage current and future patients. To that end, we established the Virus Registry, a discovery research network project, to collect and analyze data about COVID-19 patients. We aim to save lives by identifying what works well for those with SARS-CoV-2 infection. To provide you a place for discussion of all these matters with your colleagues, we launched a special COVID-19 online discussion forum. You can access it at community.sccm.org. There you can join robust conversations on many of these challenging topics. While we crave data from which to guide evidence-based care, at times, what we need most is simply staff. SCCM rapidly responded to that need and opened a call for volunteers for New York City. Hundreds of you answered, just as we anticipated you would, because SCCM members always help those in need. It is one of the many reasons that I am so very proud to be part of SCCM. TeamBased Care highlights the essential role each member plays in delivering high-level critical care. Accordingly, documents like the US ICU Resources document are updated based upon your experiences. For example, our tiered staffing strategy graphic has been enhanced. PharmDs now appear as integral team members, just where they've always been. COVID-19 patients and their families, like you, have faced unanticipated challenges. In particular, and quite appropriately, we restricted visiting. In so doing, we placed a safety barrier between patient and family-centered care and the bedside clinician. Nonetheless, you found resourceful ways to keep families engaged through phone calls, smartphone video apps, and more. The long ICU length of stay may render COVID-19 patients even more at risk for PICS. Kept at a distance, family members are likely to be highly vulnerable to the family aspect of PICS as well. They will all need your help during recovery. In the context of extraordinary care, you have been appropriately hailed in many sectors as healthcare heroes. That recognition is both important and timely, for this is a landmark year for critical care. I am delighted to share that Merriam-Webster officially recognized intensivist as a word, and it occurred just in time for National Critical Care Awareness and Recognition Month. And if there was ever a year in which critical care should be recognized, it is indeed this one. This has all been supported by our exceptionally active social media ambassador team. They help share SCCM events, breaking discoveries, and new content in each of our 3 journals: Critical Care Medicine, Critical Care Explorations, and Pediatric Critical Care Medicine. Social media links us with images, stories, and studies. But it does not anchor us in the way that in-person conversation does so very well. I look forward to that time, hopefully in the near future, when we may once again assemble under the same roof to celebrate our triumphs and share our discoveries. Until then, I wish you all the best in caring for the critically ill and injured, as well as one another. Thank you.